Hi everyone, I'm Dr. Sanchez. I'm one of the ER doctors at MVMC. This is my assistant Emma and her lovely dog and our lovely other assistant Teddy for the day. And I'm just going to show you guys how to give subcutaneous fluids, which is fluids under the skin. And this is a common procedure we do both in the ER, you may see it at your primary veterinarian, and it is something we sometimes send home as well as a treatment for some disease processes, such as things like kidney disease or other things as well. All right, so I'm just going to explain basically how we're going to put together the setup to give subcutaneous fluids at home. So you should be given a bag. It may be in a plastic material like this. It's pretty easy. You should just be able to open it straight up. Sometimes it doesn't tear all the way and the bag does like to stick to it. So sometimes you just have to give it a good shake to get it out. And then the next thing you're going to do is open up this tubing-like material here. And this essentially is going to connect the fluid bag to your pet or the patient. So once you unwrap your fluid line, what you're going to do is clamp it here. So you're going to roll this ball down. That's just so no fluid runs into the line yet. And then there's a tab on your fluid bag. So you're going to take the tab off. And then there is essentially a large piece to your fluid line. And this bore right here, which you're going to take the cap off, goes straight into your fluid line. And that allows the fluid to run into the fluid line. And we clamp it because once we turn it upside down, it'll start running. So what you want to do is then unclamp it, so unroll this ball so that the fluid can go into the fluid line before we connect it to our pet. And sometimes this part can get a little messy because it might get on your floor, so sometimes do this over a sink or something, okay? All right. So then, if you have a lovely assistant like I do, you're going to take your now run-in fluid line and you're going to connect your needle to it. And the goal is you want to keep the tip of your needle, the part that basically is going to connect your line, sterile, as well as the part that's going to go in your pet. So you don't want to touch it, put your hands over it, etc., or else you could introduce some bacteria or something to your pet, okay? Once you're ready to give the fluids and you've connected your setup, so the line's on your bag, so this is 1 liter, so you're going to be given a quantity that essentially tells you how much to give to your pet. So it may be 200, 300, etc. So we'll just pretend we're going to give 200 for today, so we're going to go down to the 2 line, that is 200 milliliters. And what you're going to do is have someone raise the bag high because we want gravity to be our friend. And then you want to find an area of your pet that has a lot of dead skin or dead space or loose skin. And that's so that we just have a lot of space for the fluid to run into. And often the best part is in between their shoulder blades. So what you would do is lift up the skin. We call this tenting the skin. And then you take your needle uncapped. We'll use a cap for now just to show you guys. And connect it and push it into the tented space in a parallel fashion. So you want to go straight into that tent, and then you can let go of your tent at that point in time and start running your subcutaneous fluids. And then once you're done giving your fluids, you can take your needle out. Sometimes they leak a little, so you can put some gauze or like a little paper towel over it for pressure for a couple seconds. And then reminder, every time you're going to give new subcutaneous fluids, you want to change your needle to a fresh needle every time.